Well, the conversation of pain comes up all the time, and there are ways to get around that that don't involve difficult surgeries or lots of medication, and that's why we have Dr. Spencer here. Thanks for being here.
Thank you.
So what are we going to talk about today?
Today we're going to talk about neck, shoulder, arm, and hand pain and where it comes from and what we can do about it in a chiropractic setting.
Neck pain can be a lot of things, but it could also mean pain everywhere else.
Exactly, it can. And I'm going to go over with you just a few things about what we examine and how we find out what's really going on with you. You know, a lot of times people have shoulder pain or shoulder restrictions or numbness or tingling down into their arm and hand, and that they think that there's a problem down there when it's really starting up here, and vice versa. And that's why a thorough exam is very important. And one of the first things we do, you know, when you come in as a new patient, we sit down and talk to you. Patients with neck pain a lot of times say they have that tight shoulders, tightness in the shoulder, hard to move their neck, waking up with cricks in their neck, just not being able to turn and bend freely. It starts to affect their driving, their sleeping. A lot of times people get headaches from neck pain. So a thorough exam and talking to them about their history. Have you had an auto accident in the past? What kind of traumas have you had? I'm always finding out, we're an adventurous society that people are, always doing little things to their bodies as they're coming up and don't realize that these things can add up to chronic pain as we get older. And so I always do a thorough history with my patients, finding out how long they've had the problem, what other treatments that have tried. Maybe some of them have worked for them short term. Maybe some of them have worked for them and they're not working anymore, and so they're having to find it. And we're people, chiropractic works without drugs and surgery. So if you want drugs and surgery, this is not the place for you. But if you want to heal yourself naturally and work on making your body the best it can be, making it the best you without drugs, shots, and surgery, then this is the place for you.
I'm here for that. Let's take a look at how different body parts can be impacted.
Okay, sure. I'm just going to have you go out on a limb and pretend this is a spine.
Got it.
Okay?
Spine.
A spine. And so each of the spinal segments should move freely like this, okay? And that allows you to turn, bend, move, drive, all the things that we're taking for granted, right? Sometimes you can get segments in your neck that lock up and don't move. And so this can be an area of concern, and we find this on examination when we're feeling the spine and around these areas where we have these problems. Sometimes the nerves can get pinched. Those nerves that are pinched can come out and go into the shoulder, or they can come out, go down to the elbow, or even certain fingers. Certain nerves go into certain fingers. So if you have pain in these fingers here, it could mean one thing, and if you have some symptoms here. And we also look for weakness, in your arms and hands. Are you losing the grip strength? Are you not able to open the jars? All of those things can come on all of the sudden. Hey, I was opening jars last week and now I can't open my jar.
I can't do it.
I don't have the finger dexterity that I used to, or whatever. Being able to turn, bend, move, use your hands is extremely important, especially for self-care.
And it's not until you realize you can't do it until you're like, I need to see somebody.
Exactly. A lot of times these people come in with shoulder pain. The muscles that work the shoulder come from the nerves that are in the neck. Almost like 90% of the nerves that are in the neck go into the shoulder muscles. So we're looking at, are these feeding the activity in that shoulder muscle and letting you have good motions? So many times I see patients that have had shoulder surgery and they're still having pain. It's because no one looked at their neck, and they need a different type of care. They repaired the rotator cuff, but they still have, areas in their neck that are not moving, that are putting pressure on nerves, and those nerves are affecting the shoulder, arm, hand, elbow, all the way down.
I have a C5-6 injury, a little bulging disc, and there was a moment where about a year ago it was going down into my arm, and like you mentioned, just kind of the inside of my arm, but it was sending some really sharp pains down and behind my shoulder blade, and I went to see a chiropractor, exactly like you're saying, and within about 6 to 8 months, all of that, well, almost instantly, it felt like within the first visit or two, a lot of that pain, the instant pain disappeared. Then it just kind of became dull pain. But after 6, 7 months, what could have been surgery and lots of medication, that was gone because of some routine adjustments.
Exactly. You know, when you mentioned that disc problem, and I'm going to show you, you know, there's disc bulges, disc herniations. Let me fix my little spine here. So when we have a bulge, that is where the material can press out from the center of the disc because of the outer fibers just becoming weakened. And what causes that weakening, we can go back to here, is that good motion is not happening in these segments when you turn, bend, and move. Part of your neck is moving, maybe 4 out of 7 is moving good, but the rest, 5, 6, and 7 are not moving good. So that can cause the disc to lose its hydration and to become weakened and allow this to happen. The great news is that your examination here will help uncover that. If you have MRIs, we'll correlate those to your condition and get the right treatment for you. Some people require non-surgical spinal decompression, which is we can do right here in the office without shots, drugs, and surgeries. This is life-changing for a lot of people who have, you know, neck, shoulder, arm, and hand pain. You know, I'm thinking about a patient that I had recently that had neck surgery. Okay, so once you have that fusion there, you know, I can't really work on that area.
Right.
But we were able to do some laser treatments for this patient because he was still having quite a bit of arm pain after the surgery and had a big muscle spasms around the area. So we worked on that, you know, and he was able to get 80–90% relief, you know, where he was thinking about, do I need another surgery in this area? This was so hard for me to recover from this one, and I'm still having arm pain.
Right.
So even post-surgical pain, you know, if you went ahead and you had the surgery and it wasn't helping you, there are so many things we can do for you outside of traditional chiropractic that can help relieve some of that pain and allow you to use your arm again that you may have lost even before the surgery took place.
I think key is making sure that you're getting here ahead of time. You don't want to wait until the last minute to have Dr. Sonia take a look at you. It's key to be preventative. If you can get in ahead of time and you can take a look at it before it becomes major, then it alleviates a lot of the problems that you may face down the road, including what could be surgery.
Exactly.
Perfect.
That's
Awesome.
exactly right.
Well, Dr. Sonia Spencer, thank you very much. Listen, Spencer Chiropractic off of Pass Road in Gulfport. Definitely want to come down and let her talk to you and get you fixed up.